So today is Thursday, November 21st, 2024, and we have Dr. Karin Varblow with us today presenting on dyslexia and ADHD. Dr. Varblow, I'm going to let you introduce yourself and tell a little bit about yourself.
Okay, I'm going to get to where I can actually see people here. There we go. So hi, I'm Dr. Varblow. I'm trained as a general pediatrician, but about 15 years ago, I opened a private practice dedicated to working just on behavioral pediatrics and mental health issues. It started out being just about ADHD, and very quickly I realized that nobody has just ADHD. People have all kinds of combinations of things, typically when they have ADHD. And so the practice has really broadened over the years. And one of the things that we commonly see with ADHD is dyslexia. So tonight's presentation is about sort of the overlap between ADHD and dyslexia. And as Jennifer was saying, if you guys have questions along the way, feel free to sort of raise your hand or pop them into the chat, I guess, into the chat. Is that the
Yep.
best way, Jennifer?
That's great.
And then if we can get to them as we go, I'll stop, and we will also leave some time at the end for Q&A. Okay.
When people raise hands, I'll get a notification. So if you have something, if I don't see you, feel free, people, on our presentation here to raise your hand. I should get a notification.
Okay. And can everyone see the slideshow? Great. Okay, doke. All right. Well, let me see why it's not advancing. There we go. Dyslexia and ADHD, they often co-occur. It's a little more confusing than that, though, because they can also mimic each other, they can mask each other, they can exacerbate each other. So it gets to be pretty confusing pretty quickly. Sorry, I should have let Jennifer do this.
I can certainly take over if you want me to.
Sure, if you wouldn't mind, that would be helpful. Thank you.
I'm going to ask for remote control.
And approve.
Thank you.
Sure, thank you. Okay, so given sort of the overlap and how confusing this picture can be, it's important to understand both dyslexia and ADHD, their differences, their similarities, so that we can arrive at the proper diagnosis or diagnoses and know what we're dealing with when it comes to designing a treatment plan. Okay.
Except oh, there we go. Okay. I was able to.
Proper diagnosis is necessary for proper treatment. Next slide. So let's start with ADHD, and I'm going to go briefly just through some of the criteria so that we have an understanding of what we're talking about. Definition of ADHD, it's a disability characterized by a persistent or ongoing pattern of inattention or hyperactivity, impulsivity that gets in the way of life or typical development. It can result in difficulty maintaining attention, beginning activities, organizing, managing tasks, working memory. It's neurobiological or neurodevelopmental in origin. There are 3 presentations of ADHD. There's primarily inattentive, primarily hyperactive impulsive, and the combination. And the least common of those is the hyperactive impulsive sort of only. Inattentive symptoms: failure to pay close attention to details, making careless mistakes, trouble maintaining attention to tasks. These are the kids who say that they're listening, and they may or may not be, but when you look at them, it looks like they're not paying attention. They may not be following through on instructions, they're losing focus, they're not finishing things, they're not organized. They may be avoidant or reluctant to engage in tasks that require sustained mental effort. They're losing things, they're easily distracted, and they can be forgetful. Next slide.
Dr. Varblow,
Yes.
a question in the chat is, why are ADHD and dyslexia comorbid?
We're going to get there, I promise. Yep, that's a great question. and that's where I'm headed. Oop, let's go back. Nope, we're going in the wrong direction here. Okay, there we go. Next slide. There we go.
Sorry
So
about
there are
that.
hyperactive impulsive symptoms, feeling on the go. These are the kids who appear to be sort of driven by a motor. They're fidgeting, they're squirming, not sitting still. They may have an inability to play quietly unless they're doing something that they just love doing. Talk excessively, blurting, interrupting. They have trouble waiting their turn, and they may intrude on other people's space, pop everybody's bubbles. Risk factors for ADHD, and this is, I'm getting closer and closer to answering the question. Risk factors: a family history of ADHD or other neurodevelopmental disabilities, prematurity or low birth weight, in utero exposure to nicotine, drugs, alcohol, or some infections. Males are at greater risk than females 2 to 1. There are individual differences in brain structure or activity, and having dyslexia or other learning difference in oneself or in other family members. These are risk factors for ADHD. Okay, let's talk about dyslexia. You guys are the experts much more than I am, but we'll just sort of briefly touch on, this is a specific learning disability or difference characterized by difficulties with accurate and or fluent word recognition and by poor spelling and decoding abilities. It's also neurobiological in origin. It can result in difficulty learning to translate print into speech, and often leads to reading comprehension impairment or the inadequacy of understanding text. Okay. Risk factors. You're going to recognize something here in a moment. Family history of dyslexia or other learning differences, prematurity or low birth weight, in utero exposure to nicotine, drugs, alcohol, and some infections. Males are at greater risk than females. There are individual differences in brain structure or activity, and having ADHD in oneself or in other family members is a risk factor for dyslexia. Next slide.
Another quick question. Why are males at a greater risk than females for ADHD? I think was the question. Or is it that males tend to act out more?
Right. What we don't know really yet for sure is whether the majority of that 2 to 1 difference is difference in presentation and diagnosis, or whether boys are actually twice as likely to have ADHD. So it's a little bit still unknown, and that's largely because there is no sort of biological test that we can do to determine objectively or more from a sort of a lab perspective whether somebody has ADHD or not. It's really diagnosed behaviorally, and so it's hard to say.
Right.
It's a good question.
And one other question about the infections in utero. Is the infection with the mother when the mother's pregnant, or with the infant after birth, or both?
In utero means when the baby is still before the baby's born in the mother.
Okay, yeah, that is
Yeah.
in utero. But, all right,
Yep.
so we don't know if that some infections after birth might cause ADHD or dyslexia.
It's not one of the known risk factors, although I will say any sort of brain injury increases the risks for both ADHD and I assume dyslexia as well. Okay, so again, this is just to sort of show you that the risk factors absolutely overlap. Risk factors for ADHD, risk factors for dyslexia are essentially the same. And so that is probably a big hint as to why they often co-occur. Next slide. So again, they may mimic each other, they may mask each other. Both of them are diagnosed based on symptoms. There is no lab test for either disorder. And so we end up with the Venn diagram that sort of looks like some overlap, but also some distinct dyslexia without ADHD and vice versa. Next slide. commonly seen behaviors in young children with dyslexia: problems forming words correctly, problems remembering or naming letters, numbers, colors, difficulty learning nursery rhymes. Next slide. In school-age children, again, problems processing or understanding what is heard, problems finding words or formulating answers to questions, difficulty remembering sequences, spelling, taking a long time to complete reading or writing tasks, and avoiding reading. And in adolescents and adults, again, difficulty reading and writing, slow, laborious process for reading or writing or avoiding altogether, difficulty with word retrieval, remembering sequences, spelling or memorizing, and summarizing stories. If we look at the inattentive symptoms of ADHD, failure to pay close attention to details or making careless mistakes, which can look a lot like having trouble with spelling or reading directions, trouble maintaining attention on tasks or play activities, such as reading and writing, not appearing to listen when spoken to directly, which can look a lot like trouble processing what is heard. You see the overlap here. Not following through on instructions, losing focus, failing to complete assignments, can look like avoiding or taking a long time to complete reading and writing assignments and tasks. Next slide. Again, and we can go through this, for each and every symptom of inattentive ADHD, it can be clearly applied to reading and writing in ways that make it, that can make it really unclear when you have a child with the symptom, for example, of difficulty formulating responses to questions or summarizing stories. Is that trouble organizing, or is that dyslexia? Avoiding tasks that require sustained mental effort. Is it sustained mental effort that's the problem, or is it actually the reading or writing that's the problem? It gets pretty complicated pretty quickly. Misplacing things can look like losing your place when you're trying to read. Getting easily distracted. Are you sort of not keeping your brain in your book because of the book, the brain to book problem, or the brain to world interface? Learning new words, memorizing facts can look like forgetfulness in daily activities. It gets pretty complicated. Again, when we look at the hyperactive impulsive symptoms, fidgeting or squirming in your seat. Well, if they're fidgeting and squirming when they're reading, is that a fidgety, squirmy problem, or is that a reading problem? Same inability to sit still or remain seated when it's expected. If whenever it's time to read, they're popping up out of their seats. And when you are working with somebody in the context of teaching them reading and working with them on reading, and the only real setting that you see them in is in the context of reading, and you see them being very squirmy and popping up and out of their seats, you don't have the context to know whether that's a reading specific behavior or a more generalized behavior for this kiddo. And so all of the symptoms for ADHD can be specifically seen only in the context of dyslexia or in the context of dyslexia and other contexts or other settings. Next slide. So as we said, the Venn diagram can look like sort of the two circles that overlap a little bit, or it can look like this other picture here where you have ADHD as the big circle and dyslexia as a smaller circle within, so that a subset of people with ADHD may have dyslexia, but not everybody with ADHD may have dyslexia. Next slide. Next, that's okay. Go ahead to the next slide. The reason that we don't see a bigger picture with dyslexia and a small subset of those with ADHD as being that confusing is because attention is required for reading, but reading is not required for attention, right? And so, again, it's just a matter of knowing the context in which you're seeing the child and being able to understand in what setting they have their challenges. Okay. I'll pause here for a second. Any other questions
Yes,
pop up?
we have
Okay.
we have a couple of interesting questions. One was, does loss of oxygen at birth cause difficulty? I'm assuming, and Christina, correct me if I'm wrong, but I think you were referring to ADHD.
Yeah, we know that brain injury can cause that. So if at birth there is a loss of oxygen, whether it caused any known brain injury or not, they're on oxygen, could that contribute?
It certainly could. I mean, anything that causes damage to the frontal cortex could lead to symptoms of ADHD. It's a little bit of a different kind of a syndrome from most cases of ADHD, which are genetic. And so it's a different sort of origin and a different mechanism for developing the disorder, but the net result can be the same, yes.
And how would a doctor know that? You would only with imaging, I would assume that you would be able to tell
You can't even tell. Oh, how would you know
whether
whether there was damage?
yeah, whether the origin is familial or from brain damage.
You wouldn't necessarily.
Okay.
It's really by history. Depends
Okay.
on if there's a family history and if there was a history of of trauma at birth.
Okay. And then the other question is, and you may get to this later on, but can you explain what's going on biologically and chemically with ADHD?
I can do that, but I think that's beyond the scope
Okay.
of this talk. We'll see if we have time at the end.
Okay.
Remind me, and we'll see if I can go into that a little bit.
Great.
For now, I'll just say that the major neurotransmitters that we're talking about when we're talking about ADHD are dopamine and norepinephrine. And I'll stop there and see how much time we have at the end.
Okay. One more question. This is another interesting one. They have great questions. Does ADHD impact executive function, or is it vice versa?
I think it depends on your definition
Yeah, and I
to
think that's
some
like a which came
degree.
first, right? Like a chicken or the egg
Right,
kind of scenario.
right. If we think about executive functions, those are anything that keep you working towards a goal, that help you define your goal, help you stay focused on that goal, keep you from getting distracted away from the goal, help you problem solve if you bump into a problem along the way, sort of what do you do about that obstacle so that you can keep moving towards the goal, how flexible can you be, all of those things. And so when you have problems with any of those or with many of those, essentially that is ADHD. So
Right.
so I don't distinguish. I really consider them as one and the same.
Yeah, and I've heard, and correct me if I'm wrong, but I've heard that there's talk of changing the DSM from ADHD to executive functioning disorder. Have you heard that?
I don't know if that's true. I know some psychologists, when they do testing, they won't diagnose ADHD very readily, but they'll diagnose executive function deficits readily. I read that as ADHD, but I didn't want to tell the parents. Essentially, with some exceptions. Certainly, people with autism can have executive function deficits that have much more to do with the autism than with the ADHD. But for the most part, when we're looking at executive functioning deficits, if those individuals meet the criteria that we've talked about, that's ADHD until proven otherwise, as
Right.
far as I'm concerned.
We have another question. Allison, I'm not sure if you meant to direct message me, but I'm going to ask you to articulate your question because I'm not quite sure what you're asking here about production issues.
Sure. So I took a learning in the brain workshop last summer about out in Santa Barbara about executive functioning and reading, writing, and math. And the presenter because I'm really trying to figure out like why ADHD and dyslexia are so commonly diagnosed together. So I was asking him that at a break, and he said that at least I wanted to see if you agreed with this, that he feels that it's actually, you'd be surprised at the low number of people who actually have a true learning disability like dyslexia, and that it's mostly a production issue, which is like related to the executive functioning. I've had a
Like
lot of students,
productivity, you mean?
yeah,
Yeah.
producing work, like either being able to read aloud or, do the writing tasks, math, etc. I've had a lot of students who are, diagnosed with both. And then once maybe they start medication, the dyslexia diagnosis gets dropped. So I just wanted to see what your thoughts are on that. Does that make sense?
Yes, absolutely. So I tend to, I agree. I think that there are many people who are diagnosed with dyslexia who may in fact have ADHD, and their non-preferred activity, one of their non-preferred activities is reading.
Yeah.
And so it looks a lot like dyslexia. One way to figure out the difference is to treat the ADHD and see if suddenly they are much more able to read. The story that I tell, or the example that I use, I can remember myself when I was in college, sort of the first time around, I was in pre-med, but I had to take a biology class because it was a stupid science requirement, and I hated every minute of it and thought it was so dumb, and I would never, ever need to know this information ever. It had no bearing on my life whatsoever. And so I would sit in the library and I would read the textbook, the biology textbook. And at the end of a 2 or 3 hour study session, if you had asked me what I had read about and studied, I would have said, I have no idea. It looked a lot like a reading comprehension problem.
Yeah.
When in fact, it was an attention problem that was at that point undiagnosed. And once I could pay attention, the reading comprehension problem just absolutely, went away into thin air.
Yeah. And we can see that with when we're remediating dyslexia, you can start to work with a kid who's been diagnosed with dyslexia and know that, okay, this child does not have dyslexia. It's just when things come so quickly, that doesn't, we can tell that it's, something else is going on.
Right. And it could be both.
Sure. Mm-hmm.
And it could be that somebody is actually dyslexic, but is diagnosed with ADHD because of the avoidant behavior, because they get squirmy and fidgety and avoidant whenever it's time to read, which is a lot of the time that they're in school. And if they have homework to do, a lot of the time that they're at home. So it can go either way. Yeah, good question.
Yeah, and I think we're good on questions. Yeah, we're good.
Okay. I want to talk a little bit about treatment for ADHD. There are 3 main types of treatment that have been shown to be helpful. There's medication, there's behavior modification, and there's the combination of both of those. The combination is most effective. Medication alone is second most effective, and behavior modification alone is third. Behavior modification does not mean therapy for the child. Behavior modification means really education for the parents and the teachers, so that the adults in the child's life are skilled at sort of getting the best behavior out of the child, figuring out the best way to sort of pull their best behavior out so that they can be their best selves. Okay. And that's there's a lot of misunderstanding about that. I think parents call me and say, do you do behavior modification? I'm going to send my child to you. Well, yes, but you're the one who needs to come to see me. Sorry,
Right.
So.
And then we have another quick question. If someone has just dyslexia, does ADHD medication ever help them?
I would say no. If they don't have any ADHD, no, it's not going to be helpful.
Probably be unethical to medicate somebody who doesn't have ADHD.
Absolutely. Absolutely. Yep. And again, and it wouldn't help. So I just want to spend a few minutes really talking about what ADHD actually is. And can you see the whole slide? So this slide is showing sort of if somebody doesn't have ADHD, how decision-making happens, okay? And how behavior happens. I think of two sort of functional parts of the brain as being relevant when we're talking about ADHD. There's the know, K-N-O-W part of the brain, and the go part of the brain. The know part of the brain is where we keep track of all the information we know. The stuff we know, like the list of spelling words that we've memorized for Friday's test, but also things like our moral code, our value system, our intentions, our goals, all the shoulds, all the rules in the classroom, as opposed to the rules on the soccer field, as opposed to the rules at home. Keeping track of all of this information, it sort of lives in the know part of the brain, okay? And we know the likely consequences of X behavior or Y behavior, or A choice or B choice, okay? All of that information lives in the brain, in the know part of the brain, okay? Then there's another part of the brain called the go part of the brain. The go part of the brain doesn't do any thinking. The go part of the brain really is just like the bus driver. It can turn the bus left, it can turn the bus right, it can hit the gas, it can hit the brakes, but there's no real thinking that happens there. So when we look at decision-making for people without ADHD, the example that I use is a child, maybe late elementary school, kiddo coming home from school, has had a long day at school, is walking in the front door, and thinks about how they're going to spend the rest of their afternoon and evening. So as they're putting their backpack down, they start to sift through what they know. They go to the know part of the brain and they're like, what do I know? I know I have a spelling test to study for on Friday. I know I have a math worksheet due tomorrow. I know I'm pretty tired and spent. I know I'm really hungry. And I know I basically have two choices here. I can choose to sort of keep my momentum going. I'm still sort of in school mode. I can go right into doing the homework. I can study for that test and do my worksheet and then be done for the evening, have my break, relax, have my snack, etc. Or I can take a brain break and I can get some food and I can relax for a little bit, refresh my brain. And then after a break, I can go back and start tackling the homework. And there's no inherently good or bad choice there, right? Either one could potentially be a great plan. But people without ADHD, they choose whatever they choose. And at some point they reflect and they think, oh, that plan did not work as intended. It turns out that when I intended to take a break, it actually ended up being really hard for me to get started again after the break or whatever. So tomorrow, I'm going to make a note to myself for tomorrow. Tomorrow, don't take the break first. Go straight to doing the homework. Or vice versa. But whatever happens, they reflect on how the afternoon and evening went. They make a note to self about what to do tomorrow. Tomorrow comes and they're walking in the door and they're putting their backpacks down and they start sifting through what they know. Hungry, tired, math worksheet, science test, note to self. There it is. Right. I promised myself that today I would execute in X or, this way or that way, whatever. And so they do. And they go, if the note to self says, don't take a break, just go right to finishing up the homework and then take your break. That's what they do. And again, it may work, it may not work. They're going to reflect, note to self, and proceed. And I think that must be lovely for people whose decision trees kind of work that way and are that reliable. Because here's what it looks like when you Well, so in that scenario, let me just sort of hit home here. The behavior reflects what you know. Okay. And the behavior is driven by what you know. So here are the things that you know, you use that information, you apply it, you go in that way. And the behavior that other people see reflects your intentions based on what you know. Okay. And that's the non-ADHD sort of brain function. Next slide. This is the ADHD brain function. And specifically, we're talking about when somebody is doing non-preferred activities or is asked to do non-preferred activities. And I just will say here, when we're doing preferred activities, there's kind of no ADHD because there's really no impairment for the most part. Okay. When people with ADHD get to do what they want to do, when they want to do it, the way they want to do it, because they want to do it, they're pretty outstanding at it, typically. However, when they are asked to do something because somebody else wants them to do it, the way somebody else wants them to do it, on time, on the time plan that somebody else has for them, just because somebody else said so, that's a whole different ballgame. And now we're talking about non-preferred activities, and the brain function actually changes. What we see when we're asking kids to engage in non-preferred activities when they have ADHD is there becomes this like block between what they know and how they go. The information that's in the knowledge bank in the brain is essentially the same, whether somebody has ADHD or not, right? People with ADHD still have the same sort of moral code, the same value system, the same intentions as anybody else. They have memorized the words for the spelling test, just like anybody else. The heart of hearts is the same. They have the same understanding of what are the likely consequences of taking this action or that action. All of that is intact. And the go part of the brain is intact. Certainly, the bus driver for somebody with ADHD can turn left, can turn right, can hit the brakes, can hit the accelerator. There's no deficit there. The deficit is in the connectivity between the no and the go. So if we take the same child coming home at the end of the school day, walking in the front door and putting down their backpack, you remember that the child without ADHD started to sift through what they knew to make a plan for the rest of the afternoon and evening. On the other hand, the child with ADHD putting down the backpack hears one and maybe two things loud and clear in their brains: starving and spent. And that's like all they know in that moment. It's the only thing in the no part of their brain that they can access is, oh my, I'm really hungry and I really need a break. And nothing else is salient enough to actually get through and impact behavior. So what happens is the bus drives to the kitchen and it gets out the family-sized bag of potato chips or whatever. And then it drives to the couch and it plops the person down there with their iPad and their family-sized bag of potato chips. And there they sit. And it may be a couple of hours before a parent walks into the room after they get home from work and sees the empty family-sized bag of potato chips that they're pretty sure was full when they went to work this morning. And they see the backpack is still unopened by the front door and the couch looks pretty well dented. And it's pretty clear that the child is on game number 437 on their iPad of whatever silly game they're playing or whatever they're doing. And the parent might ask a question that sounds something like, "What you doing?" Playing on my iPad. "Well, don't you have a test tomorrow?" "Yes." "And don't you have a math worksheet to do?" "Yes." "And don't you know it's now just about dinner time?" "Uh-huh." And the next question is generally some version of, "What were you thinking? Why? Why is this the plan that you chose?" And do you guys know the honest answer to the what were you thinking question? I see some people shaking their heads. What's the answer?
They weren't thinking.
Yeah. Oh, literally, like,
No idea.
I got nothing for you, Mom.
I had $1 for every time I said, "What were you thinking?"
Right? Right? And the kids often will say, oh, and I like, let's be honest, parents don't love that answer. Like, it feels like a cop-out answer. So we'll push them sometimes. And like, no, you don't get to get away with that. Seriously, what were you thinking? Don't you know, blah, blah, blah. Yes, I know, yes, I know, yes, I know. Well, then what were you thinking? And eventually the kids might make something up just to make you stop asking the same question because they've actually already answered it and you're still asking it. So now they're going to give you a different answer. But the honest truth is, okay, there was no connection between the behavior that you are seeing has taken place and what they know to be the best sort of way of going through their day. Okay. It's not that they didn't know better. It's that they couldn't access what they knew in order to make a different choice. So here's what adults typically do. We assume that maybe the child just doesn't understand actually how important homework is and how it really matters that they study for their tests and that they do their homework and whatever. So we sit them down and we explain to them all of the reasons why they really need to just do their homework every day. And the kids, yep, got it. And then we'll double check and make sure that they know all of the reasons, and we'll have them repeat those reasons back to us. And they'll repeat the reasons back to us. And then we will say, okay, so what's the plan for tomorrow? Are you going to come and spend tomorrow eating a family-sized bag of potato chips and playing on your phone for 3 hours? Or are you going to go straight to doing your homework? Going straight to doing my homework. Okay, cross your heart, pinky swear, hope to die. Absolutely. The plan for tomorrow is, I promise I will not go to the family-sized bag of potato chips. I will go to my homework first thing and get it done. Awesome. Deal. Tomorrow's going to be a better day. Tomorrow comes, child is walking in from school, putting the backpack down, and here's starving, done, spent. And the bus drives to the potato chips and drives to the couch, and we have an instant replay. But this time, when the parent comes in and sees the scene, their face is kind of purple, and there's like steam coming out of their ears, right? And the question about what were you thinking is louder and probably screechier. And the answer is still the same. I don't know. Don't you remember the conversation that we had 24 hours ago? Yes. And what did we decide? That I would do my homework right away after school. And did you? No. How come? Oh. It must be that while, sometimes our kids seem pretty smart, it must be that they just don't get it. So let's make sure that they really get it and go through all of the reasons why it's important to do your homework every day and all of the ways that it's going to make their lives easier tomorrow and forever after, and really hammer it down, because they must just not have understood some element of that, and that must explain this behavior. And we test them, and again, we pinky swear, and we do all the things, and tomorrow it's the same story over and over and over again. What's happening is, because the brain is not accessing all of the information that's in that knowledge bank, the bus is just driving based on impulse. And the resulting behavior does not reflect actually who the child is deep down inside, what they value, what they think is important, what matters to them. Because honestly, in the moment, the only thing that mattered was that they were starving. They were really hungry. But in the bigger picture, there's a lot that matters to them. They just couldn't sort of get there from here. And so we end up with behavior that does not reflect sort of what you know, okay? We have less impulse control, less self-control if we have ADHD when we're asked to do non-preferred activities. Next slide.
Can we pause 1 second? We have a couple
Sure.
of really good questions.
Yeah.
So one of them is only thinking about being tired and hungry. Is that related to working memory?
It is related to working memory in that most of the time we see when we do testing for kids with ADHD or individuals with ADHD, we see that their working memory is a relative weakness compared to some of their strengths.
Mhm.
It's rarely one of their strengths. But I don't know that that's exactly a working memory problem.
Yeah, okay. And then the relationship of these ADHD behaviors, what's the relationship to child development stages? So, basically, when is it age appropriate to be doing these things and when is it not? And I think that's a problem that a lot of us see. You'll see a 7-year-old boy and people say, I think that kid has ADHD, where some might look and say, he looks like a real typical 7-year-old boy to me, or a 7-year-old girl. So I think sometimes we overuse those terms and we're not always aware of child development stages.
Right. And ADHD is ironically one of like a disorder that is both overdiagnosed and underdiagnosed.
Yeah, yeah.
And so it's sort of thrown around willy-nilly, but it's also been thought that there, a huge percentage of people who actually have ADHD brains have not been diagnosed. Let's go to the next slide and we'll talk about sort of what determines whether or not it's likely ADHD or just sort of normal kid behavior. Because what happens when the connectivity between the no and the go are stimulated, we actually see behavior that looks a lot like the person without ADHD. I said that when people with ADHD get to do what they want, when they want, because they want, the way they want, they do it actually usually extremely well. They can access all of that information and proceed through the steps of executive function with excellent, progress. So it's not that people with ADHD don't have good executive functioning, which is something that we hear all the time. It's not that. It's that when they're asked to do non-preferred activities, that they can't access the executive function skills that they actually have, but can't get to from here. When they're stimulated and that connection is actually stimulated, we see behavior that reflects who these kids really are. Some of the things that can stimulate the brain, excitement, right? Again, you get to do something that's really, really cool that you're really jazzed about. You're probably going to be really into it and it's going to go well. For some of the kids, it's about movement. I have so many kids who learn their math facts on the trampoline. When they can jump and they can get a rhythm and whatever, the math facts come much more easily than if they're trying to sit still at a desk and recite math facts. Something when they're really engaged, when they're fascinated, when it feels relevant to their life. That same biology course that I squeaked through the first time I was in college, after I had graduated and was in graduate school, I decided, I think I want to be a doctor. Oops, I didn't take any pre-meds, so I had to go back and retake that biology class and all of the other pre-meds. And my reading comprehension problem was absolutely gone. I still hadn't been diagnosed with ADHD, but I had no reading comprehension problem because it was relevant to my life all of a sudden. And I was just soaking it up like crazy. Urgency. The other thing about the first time I took the biology class is by the time it was the end of the semester and the final exam was coming, I did a little math and realized that if I didn't get an A on the final, I was going to have to take the class again. Are you kidding me? That was like the worst possible thing I could imagine. All of a sudden, that urgency, like I will do anything and everything to avoid taking this class again. And I was able to learn the whole semester's worth of material in order to get an A on the final when I could not learn it throughout the whole 3 months of the semester until the last week. My brain turned on when it really felt urgent. Okay. Novelty, passion. It's different for different people. Sometimes competition works for some kids. Some kids, competition shuts them down, right? So every person is going to have their own little sort of best set of circumstances for learning for their ADHD brain to be turned on. But once it's on, there's no stopping these kids. And medication, again, is one of these things that preferentially stimulates the connectivity between the no and the go. Okay, so stimulation equals motivation. And what we end up with is behavior that does reflect who this kiddo is really deep down inside, and we can see their best self shine through when they're medicated and or when some of these other circumstances are adjusted.
Another
Questions?
another couple of questions. This is an interesting one. Does ADHD, hold on, I just lost it. Okay, here we go. Does it